right, the time is 6 o'clock, and so we'll go ahead and get started here. Thank you everybody for hopping on. Happy Wednesday, everyone. Thank you so much for joining us this evening. We're super excited to be hosting this webinar. And if you're looking to relieve those chronic migraines, tech neck, or pain in your neck, you are in the right place. We've got a ton of great information to share with you. I'm Olivia with Ethos Integrative Medicine. I'll be moderating this webinar. Before we start, feel free to remember to mute your microphones. And if you have any questions, just type them into the chat. We'll be sure to answer them at the end. If you have any specific questions pertaining to your personal care, we can't address that in this webinar today, but I highly recommend scheduling a free 15-minute consultation with Dr. Morgan Massingale. She'll be able to answer all of your questions and help you to navigate treatment options. So I'll go over more information about that at the end, so stay tuned. So I'd like to start off our webinar by introducing Dr. Morgan Massingale. She's our regenerative orthopedics expert and women's hormone specialist. Her biggest drive and approach to medicine is to help her patients achieve short-term improvements while simultaneously building the foundations for lifelong health. Today, she'll be diving into common underlying causes of neck pain, and will share her expertise on treatment options that will effectively target and treat recurring pain patterns in the neck. We're super excited to have Dr. Morgan Massingale host this webinar, and I hope you all get the chance to connect with her. She's a fantastic resource for relieving chronic migraines, tension, and pain in your neck and back. So without further ado, I'll let her get started with her presentation.
All right, thank you so much, Olivia. Really appreciate it. Welcome, everybody. So like Olivia said, we're doing a presentation tonight on neck pain. We're going to talk about some of the common things that you may have heard about, what's actually underlying some of those things, and what we can do to help you address it. So like I want to just reiterate right off the bat what Olivia said. If you're going through and have questions, please feel free to drop them in the chat. As I was preparing notes for this, I tried to make it, pretty straightforward. The 2 times 1 equals 2, 2 times 2 equals 4, right? As I got a little bit deeper into it, I realized it was looking a little bit more like calculus. So I just want to make sure that we don't let anyone get out into the weeds, right? So if it's confusing, if it's not making sense to you, please just drop that question in the chat, and hopefully we can address that and clear up any questions that you may have. Because if anything tonight, I want you to come away with a little bit more information so that you're empowered to take control of your health, okay? So just a little bit more about me and how I got into this particular field. I have a master's and or a bachelor's and a master's of science from Georgetown University. And then I spent about 7 years in the pharmaceutical research industry. Through a variety of experiences in that particular field, I found naturopathic medicine and have really found my passion in orthopedic regenerative medicine, specifically image-guided injections to help spine pain. So just to point out, that's a lot of sitting at a desk over the years, right? And we'll talk about why that is pertinent to this particular presentation. I'm going to talk about my particular journey with neck pain. They say that every physician gets into medicine to treat themselves or someone that they love, and that is not unique to my situation. My story, this was my MRI, my first year of medical school. Even to my first year med student eyes, this is not a healthy looking spine, right? The way that we see the vertebrae stacked here, we used to refer to as military neck because it's making you look like you're standing at attention, right? It really has nothing to do with military service. Now more commonly referring to it as tech neck because it's caused or due to a lot of that strain from that chronic leaning forward and posturing that we'll talk about as we get further into the presentation. For myself, that presented a 5-year history of neck pain. In a 30-year-old, that's pretty chronic at that point, right? If you attended my other low back pain seminar, you already know that I have an underlying connective tissue disorder that leaves me kind of predisposed to early onset of these sorts of things. And it presented not just as neck pain, but some left shoulder instability, numbness and tingling in both my hands, and really was a gradual onset from the age of 25 to 30 and become pretty severe and debilitating by that point. My particular diagnosis was, that forward head carriage leading to cervical facet arthropathy, and my particular treatment plan is on there. But we'll talk about, all of those things as we get more into it. So neck pain, it affects 10 to 20% of American adults currently. So over the course of a lifetime, a lot of us will experience some sort of neck pain. Common history that I see, come in, history of whiplash type injuries, history of poor posturing, so that tech neck that we'll talk about. And then, unfortunately, as we get over the age of 30, sleeping can sometimes become an extreme sport, right? And we'll talk about why that happens. So let's dive into whiplash injury. I think a lot of us are familiar with this. Very common in rear end motor vehicle collisions and side impact collisions. It's that rapid acceleration and then deceleration that causes that whipping motion of the head. And we think about it really as the acute presentation of whiplash right after an accident like that. But what I actually see in my practice is that it can actually present later on in life as early onset degenerative change. And we'll talk about why that is with the damage that it causes to different structures. The other term that we kind of have out there is that tech neck, right? So we know from Olivia's beautiful emails so far that the head weighs between, 8 and 12 pounds, depending on how big your brain is. And as we lean that head forward for different reasons, either, looking at our cell phones, poor posturing at a desk, the strain on the static and the dynamic stabilizers in the neck becomes compounded. So that pull of gravity really increases as you bring that head off of the axis that's supposed to be holding it in position. Like I said, this can also happen when you're seated at a desk. You have that rolling forward of the shoulders, that elongation of some of the dynamic stabilizers, so the muscles and musculature that's supposed to hold that cervical spine in place. And you're also fixed in that position for hours upon hours a day, right? If you're at a seated job. These types of postural considerations can be addressed, and we'll talk about that as we move forward. But there are also other postural considerations for professions like dentists, dental hygienists, that you really can't modify in the moment of the actual performance of work, but you really need to address by looking at things like strength training and physical therapy outside of the work environment. And then, like we talked about, sleep becoming an extreme sport as you get a little bit older. Really what's going on there is you have typically an underlying condition like an old sports injury, where the joint has become compromised. And because you've slept in a slightly wrong position, that underlying condition has become aggravated, and all the musculature around it kind of clamps down, causing a splint, which causes that stiffness, inability to rotate and look over our shoulder, that sort of thing. So let's get into the actual structures that have been affected here, right? So we're going to talk about three main things. We're going to talk about cervical facets. Those are the actual joints where each of your vertebrae line up on top of one another. And we're going to talk about the superficial nerves that overlie those. We're also going to talk about how muscular imbalance and muscular tension can really affect all of these structures. One of the things to keep in mind here is that, my mentor always liked to remind me, patients are allowed to have more than one thing, right? And especially in the case of cervical spine pain, a lot of these issues beget one another. So if you have a ligament instability, it can cause some other things down the road. And we'll talk about how those kind of add up and compound as you move forward. So like I said, the cervical facets are, my nice little skeleton friend here is the joint that is circled in red, right? You have one, actually you have two at each level where the spinal segments connect together. This particular joint is the one that allows for that great range of motion that we think of in both the cervical and then the lumbar spine, so the low back. So it allows for that rotation, it allows for that side bending, it allows for that extension of the spine. So telltale symptoms of a problem with this particular joint is actually pain with any of those movements. That's not to say that the pain goes away completely when you're at rest, but if that pain gets worse with those type of movements, we really need to be thinking about the cervical facet joint itself. Sometimes here you can see radiating patterns into the arm, and the reason for that is because of the nerves that provide the innervation to those particular joints. Have very close feedback into the spine, right? So if you have inflammation in that joint itself, it's going to cause, disruption in its neighboring tissues, right? So some of that nervous tissue as it's coming back from the arms, you can experience some pain, numbness, burning sensation in the arms as well. Also of note here is this joint is kind of the target for some of the denervation procedures that you see in allopathic type medicine, so ablation procedures, that sort of thing. So as I promised, we're also going to talk a little bit about the ligaments in this area. So just looking at this side view, you can see there are a number of ligaments or static stabilizers that allow for that gentle C-curve shape that's supposed to be the natural shape of the neck, right? So let's kind of touch back on the issues that we talked about before, that whiplash injury and that tech neck, right? So if you think about whiplash and the motion that's happening there, you have a very severe and acute forward and then back motion of that cervical spine, which is causing very acute stress and strain on these ligaments. First in a stretching motion and then in a compressive fashion. Now, hopefully, if you've ever experienced this type of injury, you were able to heal appropriately and everything's been perfectly fine ever since. Unfortunately, with some people, they just don't have the building blocks to adequately heal after this type of injury, and those ligaments become permanently damaged. They can become too stretched out, which allows for excessive motion in the cervical spine, and it allows for that kind of straightened neck posture that we see. With tech neck, it's really a more chronic and insidious stretching of those same ligaments. So if you have that forward posture for a very long time, all of the tissue up front is going to adapt to that by becoming shorter, and all the tissue in the back is going to adapt to that by stretching out and becoming longer. Think of it as kind of like a rubber band if you just pull on it for too long, right? For women, for the hair elastics, right? You use it so many times and it just never goes back to that original shape because you've had that stress and tension on it for so long. Same thing can happen with our ligaments. So that chronic forward head posture of tech neck can cause ligament problems where it's not getting that proper support that we're looking for. And then we're going to talk a little bit about the superficial nerve inflammation component here. So again, my little model here, we're looking from behind, and the little yellow spaghetti-like structures are superficial nerves. So the nerves that come out and penetrate all the way from the level of the spine to the level overlying the muscle tissue underlying the skin. And you can kind of see from the patterns that we're looking at here, they overlie the spinal structures that we've been talking about. So a lot of times they can be confused with some deeper pathology. And also you have nerves that are coming up and wrapping around the back of the head. So if you've got that forward head carriage, right, and it's become chronic to the point where your connective tissue is kind of pulling on those nerves, irritating and inflaming them. It can have referral patterns up into the head that very much mimic headaches and migraines. telltale symptoms that this is going on and not a deeper level pathology like a facet arthropathy, like we talked about a minute ago, is that this particular condition is going to be better with rest and worse with movement. Where if you have a degenerative condition in the actual spinal segments, you tend to find that it becomes achy with rest and feels a little bit better as you get going, right? You get up in the morning and you get moving and everything gets kind of loosened up. So this is going to be exactly the opposite. Superficial nerve inflammation, also you won't see those radiating patterns. So what are your options here, right? So I'm going to talk to you about, the conventional treatment options. I spent a lot of time in that world. And I also think it's really important for patients to know everything that's available to them. So in the allopathic kind of therapeutic order, you'd be started with a non-steroidal anti-inflammatory drug. So that could be your over-the-counter like ibuprofen or Aleve, prescription meloxicam and naproxen, things like that. Short-term, non-steroidal anti-inflammatory drugs or NSAIDs can be very good at stopping inflammation. So if that's a component of what's going on with you, it will provide short-term relief. Chronically, however, we see concerns with GI problems like ulcers develop with chronic NSAID use. Kind of the next step up from that is narcotic pain medications. I think we're all pretty well aware of the opioid epidemic as it exists in our country today. From the overprescription of these types of pain medications. One of the things that we see long-term especially is habituation to these medications, which means that your body becomes used to it and starts needing higher and higher doses to achieve the same effect. So definitely long-term is not a great pain control option. The next thing that we, is out there are steroid injections. So steroid injections are a higher level anti-inflammatory medication delivered directly to the tissue that is a problem. Kind of a short-term fix for most people, and unfortunately it has both short-term and long-term drawbacks. The short-term drawbacks, it can actually cause blood sugar dysregulation. So if you have a patient or you are a patient that has any sort of underlying metabolic condition like diabetes, this will throw your blood sugars out of control for several days, which is, not great for your long-term health, right? And then in the long term, steroid injections are actually limited by number that you receive into a particular joint. The reason for that is it causes breakdown of cartilage. So when you are delivering steroids into a facet joint or into a larger joint like a hip or knee, you can only receive so many of those because it actually makes the problem worse in the long term. It continues to break down that tissue that's supposed to be providing cushioning and stability to that particular joint. We touched on a little bit ablation therapies. Ablation therapies go in and actually burn the nerve that is causing pain. For some patients, this sounds like a great option. It seems to be a little bit more short-term than we originally thought about. And the reason for that is because our nervous system is a lot more plastic than we originally knew. And that just means that it has the ability to adapt and change to problems. So your nervous system and your body as a whole grows in a very specific way. And it's a very complex system that's built very intricately. When you cut off the signal from a nerve, not only you're cutting off the sensory feedback, so that pain signal, but you're cutting off the motor output of that nerve as well, because they run in dual tracks. Your body knows that it needs to send those signals, right? You have a lot of small stability muscles around the spine that are controlled by that particular nerve. And so the body does its best to actually regrow and relearn those pathways. So ablation therapies tend not to be a permanent fix for people. Physical therapy is on the allopathic order. I think it's kind of out of order here, but it's definitely in my order of operations as well. with a caveat that you should be working with a physical therapist who is well trained in spinal conditions. Just like all physicians are not created equal, all physical therapists are not created equal. And if you are working with someone, make sure that they know who they're referring you to and that that person has adequate training and experience with the type of condition that you're treating. And then lastly, on this conventional treatment option list, we have surgery, right? So one of the most common surgeries, especially with the conditions that we've talked about so far, are fusion surgeries. So, you recognize that you have excessive motion in those joints. So a surgeon will go in and actually fuse that joint together. Like I said, with the ablation therapies, the body is very smart and it tries to work around problems, right? The range of motion that you have in your spine is a beautiful thing, and your body wants to maintain that because you need to look over your shoulder to see if something's coming up behind you. You need to be able to, get that full range. So what we see is that when we fuse or limit motion in a particular segment, the segment above and the segment below actually become more mobile to compensate for that fusion. So this is a surgery, unfortunately, that tends to beget more surgery. Someone who has had a spinal fusion tends to be back into that surgeon's office within the next 5 to 10 years for additional fusion surgeries. There is a time and place for all types of medicine, but I just want to make sure that patients are well informed about kind of, the outcomes and the long-term efficacy of what they're opting to do. So all that being said, what is our approach, right? So at Ethos, we have this great little model, and there are 3 of the 4 of these that I address in office with my patients. That neuromuscular feedback. So making sure that if there's any nerve inflammation that's sending misappropriate signals, that we are addressing that. We can talk, and we'll talk about the types of injection therapies that would be appropriate for that. Also, this is where I bring in my referral partners and make sure that you're getting into physical therapy to help address any instability or compromised musculoskeletal system. Stability and articulation. I think we've touched on this quite a bit so far. So that ligamentous stability, those static stabilizers that are supposed to hold the joints in their proper position, are a great target for injection therapy. And that really helps with that articulation. So when static stabilizers, so those ligaments allow excessive motion, what they're doing is allowing excessive rubbing of the joint surface on together, right? Which leads to early breakdown of cartilage, which we know as arthritis, so osteoarthritis. We can also target that with specific injection therapies. The symmetry aspect is going to be looking at workplace ergonomics, looking at postural issues, getting you into physical therapy and massage if that's going to be beneficial in your particular case. And looking at that whole approach. So then how do we build a treatment plan around that, right? So one of the things that I really appreciate about a lot of the partners that we work with is the understanding that a treatment plan is only as good as it is getting you back to your particular goals, right? So if my treatment plan is to tell you, yeah, you're going to have surgery and then you're not going to do the things that you love for the rest of your life, that doesn't sound particularly great to me. If your goal is to, get back to running without pain, get back to yoga without pain, do the active things that you want to do, that's going to be our goal. And that's what we're going to be working towards, is to get you back to doing the things that you love. And how do we do that? We start with a comprehensive evaluation, right? Unfortunately, I see a lot of patients that have seen other providers and have not really had a thorough physical exam. Other providers may be relying more on imaging to tell them what's going on. In the spine, I hands down am gonna have imaging on board to make sure that we're seeing the full picture, but a comprehensive evaluation, which is a physical exam and a thorough history of how long this has been going on, how it's affecting you, what makes it better and worse, that sort of thing is really important information to know exactly what structures are compromised and what we can work on. So that's part of that, getting that accurate diagnosis, right? And then once we get that accurate diagnosis, we can build a treatment plan around that. And there are a lot of different things that go into building an appropriate treatment plan. Modifying activity. So we may ask you to scale back on some things. We may ask you to scale up on some things, right? Start strengthening some muscles. We need you to start focusing on some nutritional aspects. If we're going to look at doing a regenerative injection therapy, so to help rebuild some of that tissue that's been compromised, we need to make sure that you have enough of those building blocks to heal on board. So are you getting enough protein in your diet? Are you getting enough collagen? Are you getting enough zinc to help build up those tissues as we're asking them to heal? For some people, you can get that entirely through diet. Other people, you may need to do some more tissue-specific supplementation. This can also be really beneficial to make sure you're getting adequate blood flow to the tissue, that sort of thing. There's no one-size-fits-all treatment plan here. It's going to be really looking at your current status, how quickly you're looking to get back to your goals, and then what you're able and wanting to do. And I think it's really important to point that out because there are a lot of regenerative physicians out there. And a term that I've affectionately picked up over the years is injection mill. There are a number of regenerative docs out there that charge very high ticket prices on their injection therapies, and they're not seeing particularly stellar results, right? I don't think these particular people are doing and building things the way that we are. They're not getting a comprehensive evaluation. They're not getting an accurate diagnosis. They're not focusing on all of the other aspects that are going to allow you to really heal and get the most out of injection therapy. So let's talk about it. Let's talk about injection therapies. The common term out there is prolotherapy, right? So prolotherapy is actually an umbrella term, prolo being a prefix meaning proliferative. So any of these injection therapies are really targeted towards proliferating or help regenerate and heal tissue. And there's 3 different levels of kind of how we achieve that. The base level is a dextrose prolotherapy, and dextrose prolotherapy has really become synonymous with that term prolo. It is a dilute sugar, so dextrose, and a local anesthetic. And what it does is it goes in and causes some targeted inflammation and helps tighten up those ligaments. So any of those conditions that we talked about so far, that old whiplash injury, tech neck, that sort of thing, bringing those ligaments back into the proper position so they can hold the bones where they're supposed to be, take some of that stress off of the musculature, can be really therapeutic for patients. The next step up from there is platelet-rich plasma. So we take a patient's blood, we spin it down, and then we take the portion of the plasma that's actually richest in growth factors, and we inject that back in. The target tissues here, similar to prolotherapy, is really great at helping tighten ligaments and heal any tendon issues, so that where the muscle attaches to the bone. It's also really great inside the joint itself. So if you've gotten to the point where the articular surface, so that cartilage surface inside that small joint, has started to show the signs of arthritis, getting in there with some platelet-rich plasma can really help rebuild that cartilage tissue, as well as tightening up those ligaments and providing a kind of multi-stepped healing approach here. The last, which isn't on my slide set because we don't actually currently offer this at Ethos, is stem cell therapies. Knowing that those are on the same spectrum of proliferative therapy as these other injections is really beneficial. I find for most patients that is not a necessary step to take. Most patients are able to achieve great healing from either prolotherapy or platelet-rich plasma. And there are some cases where stem cells may be indicated, and if that's the case, your provider should be talking to you about that. But like I said, at Ethos at this time, it's not a thing that we offer. The last type of injection therapy we're going to talk about today is perineural injections. So this is really best for those superficial nerves that we talked about earlier, right? So if you've been in that chronic forward position, that connective tissue is stretched out and stressing those nerves, and has caused that nervous tissue to become inflamed. Perineural is a 5% dextrose solution, so a really dilute sugar solution that is injected right next to those nerves, perineural. Name says it all. And what it does is it helps calm down that inflammation in the nerves. And it's almost like a reset button for those nerves. So it helps just calm them down, which allows them to stop sending misappropriate signals out to the body. Interestingly, it actually attaches and affects the same receptor, the TRPV1 receptor, as your topical like CBD oils and capsaicin. So it attaches to that same receptor and provides just a more lasting and deeper kind of relief to those nerves. This is particularly effective for patients where, like we talked about before, that posturing has caused headaches and migraines, because it helps calm down those nerves, relieve that tension, and allow you to get that work done to bring everything back into the right position. And it can be hugely powerful in bringing down the intensity and the frequency of migraines associated with those types of conditions. So I know that was a lot to cover, but I just wanted to kind of close by, thanking you all for coming. Well, I know that there's some comments in the chat. We'll make sure that we address any questions that have been dropped in there. And just reiterating that, today's webinar, we can't really address any specific medical concerns that you might have. It's more general questions. If you have condition-specific questions that you'd like answered, scheduling a free 15-minute can be a great way to go. Discovering what treatments are possible for your particular case, and then getting to know, me as a provider. One of the best things about getting to know your provider is making sure that you're going to work well together, right? You don't want to go see someone who doesn't jive with the way that you think and the way that you want to get things done. So, make sure that that's on the docket. You can do that by messaging Olivia or calling the office. The number's on the screen. And then I know that Olivia has some closing remarks. I'm going to stop sharing.
Yeah, so if anyone has any questions at this time, just type them into the chat and I'll go ahead and ask them out loud for Dr. Morgan here. I'll just throw out a couple questions that I had listening to your fabulous webinar. So like you said at the beginning of your presentation, a lot of us are working from home or are working at a desk. So would something like a standing desk be a good option for combating tech neck and kind of relieving that neck pain?
Yeah, so addressing the ergonomics of your particular workstation can be really beneficial. And one of the things that you don't necessarily know, and your physician should be helping you navigate, a lot of HR departments will actually help you get these different setups. If you are in pain, you're not productive, and your particular job wants you to be productive, right? So a lot of times they will help set up these more ergonomic workstations for you. I see a comment in the chat if insurance covers any of these types of therapies. Unfortunately, it does not. So the allopathic insurance model isn't really interested in healing at this time. A lot of coverage is available for medications and surgery, not for regenerative injection therapy.
Good question to have. And then another question that I had off the top of my head is, are there any at-home tips that you would recommend for kind of short-term relief if you're experiencing any neck or neck pain as well?
Yeah, so one of the actual great features that a lot of fitness devices have now is the reminder to get up and move, right? So even just 5-10 minutes of getting up and walking around, so breaking up that monotony of sitting at a desk or sitting for a prolonged period of time can be really helpful in combating that slumped over, seated posture, getting us to get up, take a deep breath, move around, get those muscles and joints moving like they're supposed to.
Awesome. If anyone else has any questions, please type them in the chat. We'll answer them right before we close everything. We have another question. So is there a pillow type that you would recommend?
It would really depend on what's going on with you in your particular case. There's no one pillow that I think really fits everybody. It's going to depend on if you're a stomach sleeper, a side sleeper, a back sleeper, if you have that forward head posture, if you've got exaggerated curvature in your spine. So that's going to be particular to your case.
Would you look for something that's a little bit more firmer, kind of supportive if you are like a back sleeper? I am a back
sleeper. If you're a back sleeper, that could be a good option for you. There are also pillows out there that have that C shape that kind of reinforces that for you overnight. However, that's not a great option for everyone. So definitely don't want to make a blanket recommendation, but there are a lot of options out there.
These are great questions. I like them.
Yeah.
Alrighty. Well, thank you, Dr. Morgan, for hosting this webinar. It's very refreshing to hear your approach to identifying and treating neck pain and the symptoms that are associated with it. Thank you to everyone for joining us today. And I hope you learned something new about the kind of lifestyle factors or injuries that can affect those structures in your neck. And if you take anything away from this webinar, I hope you understand that if you are experiencing any pain, you don't have to live with it forever. There is a physician out there who will take the time to understand your situation and work with you to create a solid treatment plan that's best for you and your lifestyle. So again, if you have any specific questions pertaining to your personal care, I highly recommend scheduling that free 15-minute consultation with Dr. Morgan Massingale. She'll be able to answer those questions and kind of help you to navigate a treatment option that's best for you and again, your lifestyle. So you can give our office a call to set up an appointment. I will go ahead and leave the phone number in the chat for you guys and our website URL as well if you guys want to check out our Ethos Scottsdale website. So we look forward to connecting with you soon. I hope you all have a wonderful, relaxing, extended weekend, and thank you again for joining us.
Thank you so much.